We end the semester, we're excited for our students. And to be honest, we're also excited for ourselves because we feel like we have accomplished a major goal. We have supported students on their journey to achieve academic success. So we do celebrate for our students, but we also celebrate for ourselves. Well, in this snapshot, what we want to further explore is going to be looking at our ability to achieve success in the classroom and on the CNE exam as it relates to engaging in a way that allows us to apply the concepts that we have reviewed based on the NLN Nurse Educator competencies and our textbook, which is Billings and Halstead. If this is the first time you are joining us, welcome. We are excited that you found us, and we want to know from you, how did you find us? So go ahead and put that in the comments. We do review our comments. If you're watching this when it's initially launched, we do respond. We log in and we engage in discussions or questions that you all may have. So we encourage you to put in the comments any questions or any comments that you have. And then second of all, we want you to go ahead, not only and pull out Billings and Halstead if you haven't already, is to go ahead and subscribe to our channel. That way you'll be notified when there's a new snapshot release, which usually happens every week. And then the third step is to go ahead and print out the study worksheet. You're going to find that right here in the description. This is going to help you stay focused as you're moving forward through our content today, as well as when you're moving forward on your journey to achieve nurse educator excellence. Our mission, I know it's quite lofty, is to support all nurse educators to achieve certification on the CNE exam, on the CHESI exam. Some of you may even be on a journey for a different exam, and you can carry over some of these techniques and strategies that we are discussing in our snapshots. All right, so we've taken care of the housekeeping tips. One more before we jump into our presentation, and that is that we use Canva as our platform. So it's not the LMS Canvas, it's called Canva, so no S at the end. What we like about Canva is that it allows you to access the content because it's web-based from wherever you're located. It also just creates an easier way to share the content from the presentations with your students. Right now, we have colleagues that have just started their journey with the CNE in 60 Days program, and that is the platform that we use. How many of us sometimes struggle after we attend a conference, after we attend a webinar, to find that email, right? So many of us waste time trying to search and figure out, where did we put that document? It was such a good presentation. Maybe we took notes, but we can't find it. Well, if you use Canva, you don't have to worry about that. And at Dr. Sellars Educate, we put all of our content in portals. So when you log into our website, drsellarseducate.com, you will see a list of all of our programs. Some of them are not available for public view. So if you are curious about a program like our Novice Nurse Educator program, you can definitely reach out to us, info@drsellarseducate.com. But 90% of our programs are on our website. Okay, so we're here to answer any questions that you have about products or about programs that you need as you move forward on your journey. All right, so we're going to start a little different this time. You may already have our thought-provoking question, and if you do, that's great. We're going to save that to the middle, though, for this snapshot. We want to increase engagement a little bit more as we dig into our content. All right, so first, we're going to talk a little bit about this new update from NLN, right? It's kind of hot off the press. This was actually published in September. And when we go to the website, you'll see that it was announced in August, but it was noted during the summit that NLN has every year. We encourage all colleagues to attend the NLN Summit. We usually have one content expert that's a part of the Dr. Sellars Educate team that does attend and take notes. So we get the most current information about any updates that NLN has to share. So 70%. So yes, we want to celebrate this mark because it's better than 64% that was reported in 2023. What we know about the CNE exam still remains the same. 70 to 80% of those questions that you're going to see out of the 130 that will be scored are going to be at that application and analysis level. Now, there are some components at that recall or memorization level, at that lowest level of the cognitive learning domain, but 70% we know is not where we want to be because we have the mission to support all colleagues to achieve certification. A key step on your journey to success is making sure you fully understand the aspects of application that you can expect to see play out on the CNE exam. Okay, so we know the data is constantly changing about the success rate, and we like to bring you the most current information as soon as it's available to us. This is a great quote that I wanted to share with you all that was mentioned to me a few days ago. Motivation gets you started. Habit keeps you going. Discipline keeps you growing. Okay, so this is from one of my coaches. His name is Coach Lynch. And what I love about this quote is that it really does speak to how we feel oftentimes when we start a new journey or when we start a new venture, right? We're really motivated, we're really excited. That comes from within. We know we can create engaging learning experiences with our students that can trigger their motivation. It can encourage them to be more motivated, but that comes from within, right? That has to start internally. And then the second phase of what happens as we move forward on our journey is that we develop these habits, hopefully, right? We are consistent with our practice, as I mentioned earlier, that we release a snapshot usually every week. That's really important in order for you all to feel like you can trust that we're going to provide consistent content right here on our YouTube channel that you can engage in to help support ultimately your ability to be disciplined in your approach to achieve nurse educator certification or to become a better nurse educator. That's what keeps you growing, having that discipline and showing consistency as you're writing down what your goal is on that study worksheet. So go ahead and write down today's date, whatever day you're watching this snapshot. And we want you to write down what objective do you want to achieve as a result of the time you are spending today. Time is our most valuable asset. I want you all, as you're listening to this content, I want you to go ahead and put time in the comments. Okay, that's going to let us know that you're staying engaged in our conversation today. Time is our most valuable asset because once it's gone, we can't get it back. So we want to engage in a discipline process to help us get better at least 1% every day. All right, I've shared with you all that there's information that's released from NLN about certification updates. This is an actual newsletter. I know you probably have not, the majority have not seen this newsletter or this site before. It's a little bit hard to get to. Usually we Google it or we save it as a tab on our laptop, on our computer. So this is usually a newsletter from the chair. And this is where we found information. And you can see Brenda Morris is the chair of the Certification Board of Commissioners. I've mentioned in our programs before that the commissioners spend quite a bit of time reviewing content, making sure that it's updated with the most relevant information. And so there's an explanation of the actual process that they go through on the actual CNE website. Okay, so if you go to nln.org and then you click certification at the top menu, then you go to CNE landing page, and that's where you'll see information about the process that the team, the NLN team, goes through to make sure they are developing valid and reliable exams that are going to validate that we have achieved a high level of competency as it relates to the nurse educator competencies. And so I just want to point out one component of his update. And this is Dr. Larry Simmons. He's the Senior Director of Credentialing. All right, so he posted here, and they gave this update during the summit, as I mentioned earlier, that the pass rates for 2024 to date, so technically it was August, but it was announced in September, that CNE was at 70%. Still, again, not where we want to be, but we're headed in the right direction. In Dr. Sellars Educate, we see usually a 98 to 100% success rate. Sometimes we dip to 97. And then 74% for CNE clinical. We have a 100% success rate for CNE clinical that we are continuing to track. We gather data from colleagues as self-reported. In fact, before we started this snapshot, we heard from a colleague that they had achieved success on the CNE. So that's how we track our data in case you're curious. And then for the novice, it's 84%. And we have had 100% for CNE novice from colleagues that have taken that exam from the very beginning. We launched our content review. We have a self-paced course, and we also have a live masterclass. For all three of our exams, we've actually, that's another new update that we'll officially announce in 2025, but we have combined all of the CNE content prep for CNE, CNE Clinical, CNE Novice. Now, this is going to be super beneficial for you all that are thinking about taking the CNE and CNE Clinical as well. So we'll officially announce that and invite everybody to a webinar to talk about what does that really look like and why is it so important in 2025, later in January. All right, so I just wanted to bring to your attention where we got that data from as it relates to the success rate. Now we're going to go back to our content, and we will again look at our thought-provoking question when we get a little further into our content review today. We don't want you to waste time or resources. That 70% is not ideal. How many of us would have to submit an action plan to the Board of Nursing if we had a 70% NCLEX pass rate, right? And one of the major contributing factors to lack of success on the CNE exam is due to lack of proper preparation. So not having the right resources. You only need Billings and Halstead right now. It's the 6th edition that was mapped to the exam in 2024. However, there is an actual crosswalk of the 7th edition of Billings and Halstead right here in the description. And we've compared the two textbooks. There's not a whole lot of difference in the content. The major area is one of our favorite tables, which is table 14.1, which is learning theory. I know we refer to that table all the time, and unfortunately, it is not included in the 7th edition, but it is on page 249 in the 6th edition. Okay, so you can see again what those pass rates were. So when we talk about application, it really does start with us doing a self-reflection of where we are as it relates to the competencies aligned with competency 1 and competency 2 primarily, with the ability for us to engage students in the learning process. Okay, so 2 theories I want you to write down on your study worksheet. That's going to be Kolb experiential learning theory, as well as Malcolm Knowles adult learning theory. Those are the 2 primary ones. Now, there's correlation and relationships with a lot of different theories associated with active learning and high impact teaching practices. But for purposes of this snapshot, I want you to write down and focus on those 2 learning theories. Okay, again, I want you to focus on Kolb experiential learning theory, KOLB, and Malcolm Knowles adult learning theory. When we look at just a few examples of those teaching strategies that we want to develop as part of our teaching plan, we want learning to start before students cross over into our threshold in the classroom. Well, how does that possibly happen? We teach adults. So there's a self-directed component of the learning process that students have to engage in. Pre-class assignments is just one of those ways that we can create or really stimulate that learning process to happen before students enter into our classroom setting. And we use the term classroom in general. We know that colleagues are facilitating teaching and coaching through the learning phases in the skills lab, with the simulation experiences, as well as in the clinical setting. Okay, so again, these terms or these teaching strategies are going to look different based on the setting, but we know learning happens beyond just the time in seat, right? Or beyond just the didactic experiences. Simulation, technology, these are all strategies that we want to leverage to help students learn, to keep them moving through the learning process. Now, I want to go ahead and point out that when it comes to active teaching and learning, not only is that for our students, but that's also for us as it relates to our ability to become a better nurse educator every day. So what does that look like? Well, it starts with us taking a look at ourselves and doing a deep dive and identifying where are our knowledge gaps. That's going to start with us looking at those 63 sub-competency statements or knowledge statements that's included on that blueprint, okay, that detailed exam blueprint that is a part of the NLN candidate handbook for each of the 3 exams. So that's what you want to do as a first step. Go ahead and do a self-assessment and see where you are. Where do your behaviors line up today as it relates to all 63 of those sub-competency statements? So that's step 1. Step 2 is using Billings and Halstead to identify, how am I going to bridge the theory practice gap? It's not enough just for us to memorize Malcolm Knowles adult learning theory to know what behaviors can we develop in our students and help them develop ultimately to help them be more self-directed in their learning? Well, active learning, active teaching strategies. And then with COBE experiential learning theory, how do we get students unstuck when they don't connect the dots? How do we keep them engaged? How do we promote the completion of those 4 phases as it relates to the COBE's experiential learning theory process? Okay, so it's not just for our students when we think about active teaching and learning. We as colleagues, we as nurse educators also want to engage in active learning strategies so that we can ensure that our students and ultimately that we are providing the best experiences for them as we think about how we can learn and become a better nurse educator. All right, so for whatever reason, Zoom does not like for me to continue to share. It likes for me to stop sharing Canva before I close the window, but I chose to not pause it. And so I have to go back out and go back in. And that's the other point of technology. Listen, we've all had it happen to us where things don't go quite as planned, right? We have our best intentions. We set up this great presentation and then it doesn't work. So what do? Well, we can't allow it to become a barrier to the learning experience. So we want to just be honest with our students. We want to think about a plan B option. And hopefully we're able to continue to support the learning process in the classroom, even though technology may not go as planned. We're engaging in Malcolm Knowles' adult learning theory, going back to what we mentioned earlier, that active learning experiences, those active learning experiences that we're creating for our students has to start with us. We have to be knowledgeable, competent, and skilled in our ability to facilitate the learning process with our students. We want to be that coach. We don't want to only be the sage on the stage, right? There's an element to that that's necessary, but ideally we want to be that coach. We want to be a guide on the side in order to support the actual facilitation and transference of knowledge. All right, so you want to take a look in Billings and Halstead. Again, we're using the 6th edition on page 188 through 190. And let's go back actually to page 187, where you're going to see a description of active and passive learning. When you're looking at the description of each of these 2 types of learning approaches, I want you to take note. Okay, we're going to do a little bit more of this at the end, but right now, I want you to write down on your study worksheet, how are you currently, just pick one class, how are you currently engaging students in the passive learning process? Maybe write down 2 approaches you're using. Then I want you to write down 3 active learning strategies that you are using, okay? Or if you can't name 3, I want you to write down maybe 2 that you're using and 1 that you want to start using next semester, okay? And I know if you all are watching this when it's launched, then we're on semester break, holiday break, and that's okay. Just think about maybe 1 class from the fall semester. And if you're watching this as a replay, whatever point you are in the semester, just pick a course, write down again 2 ways you're engaging in passive learning and 3 ways that you're engaging in active learning. All right, and then the next step we want you to take is on page 188. There are 3 learning domains, and part of our journey, this is our first snapshot in a 3-part series. Okay, so in this snapshot, we're focusing on application, but you're going to be exploring pages 188 through 190 and looking at not only that lowest level of cognitive learning domain, not only cognitive learning domain, but as we're talking about here, application analysis, that highest level of creating. And then we're also going to explore the other 2 learning domains, which are psychomotor and affective. All right, so as we wrap up our last few slides of content before we get to our thought-provoking question, when we engage in adult learning theory, there are 3 categories that we want you to consider. First, engaging and committing to constant updates, going back to, right, that motivation versus habits versus discipline. So think about throughout those 3 different, I like to call them phases of change and phases of integrating maybe a new strategy that you've identified for active learning. What do you need to tap into? What resource do you need to help you become a better nurse educator? Billings and Halstead, I mentioned as a resource. So going back to the evidence, NLN, AACN, how are you going to stay updated about those evidence-based approaches? And then that second category is really that application element, thinking about what are the real life tangible kinesthetic experiences that I am incorporating into my learning experiences with my students, as well as what kind of accountability am I holding myself to in order to become a better nurse educator? How am I applying these concepts that I'm learning about as a self-directed learner? How am I applying them in my everyday teaching experiences that I'm developing for my students? And then this last category, when we talk about lifelong learning and our commitment to engaging in application, is practice. Okay, so we engage in thought-provoking questions, which are exam style questions, but most importantly, we want you to think about, what is the question asking me, and what is it that I know for sure? We hear from many colleagues. I will stop sharing or press escape. That's what Zoom likes before I close it out. But what we really hear from nurse educator colleagues is that, I understand the content. It's important for me to review before I take the exam, but I really want more practice questions. And this is what we say: it's important to understand content and those concepts that are integrated in those practice questions and thought-provoking questions. We don't recommend any other practice questions other than, number one, Dr. Caputi's review book. At the end of every chapter, there are practice questions, okay? And then the second resource is going to be NLN self-assessment exam. That's on their website. And there's a reason why we only recommend those two options. Number one is because that's what NLN recommends, right? And we want to be aligned with their recommendations. We're not endorsed by NLN. We simply follow their recommendations, follow their guidelines, okay? And we pass that information on to you. And then the second reason is because we don't know if those resources that have those practice questions, we don't know what their primary source is related to content. We don't know who wrote those exam questions. Okay, so that's why these are the only two resources that we recommend, are going to be Dr. Caputi's review book and NLN's self-assessment exam that is on their website. All right, now we're ready to go back and take a look at the thought-provoking question and see what you all think about this question. All right, so here we go. A nurse educator is designing a course for new nursing students to develop clinical judgment skills. Which of the following strategies most effectively demonstrates application level learning based on Bloom's taxonomy? Okay, so we have A, ask students to list the steps of the nursing process for prioritizing care. B, provide a case scenario and ask students to create a care plan addressing the patient's immediate needs. Or C, have students memorize the definitions of clinical judgment and critical thinking. All right, so I'll come back on camera. And I want you to think about the two-step process that we recommend. First, think about, what is this question really asking me? In this thought-provoking question, you see in the stem, there's a statement. Sometimes that statement is a distractor and it really has nothing to do with the question. Okay, sometimes it does. And then the second part of this stem is what is being asked of you, right? So which of the following strategies most effectively demonstrates application level learning? Okay, so what you would want to think about is, what is it that I know for sure about Bloom's taxonomy? Maybe you want to do a little bit of a brain dump. You should receive a scratch piece of paper or a dry erase board that you can write on to take notes when you go to the testing site. If you have any questions about that, you can always ask the proctor, but normally they do give that to you. Maybe you decide, you know what, I don't want to get distracted or confused about Bloom's taxonomy. So as soon as I sit down, I'm going to draw out Bloom's taxonomy. You just want to be mindful of your time because you do have 3 hours to take the exam. Now we want to do a little bit of a reflection. Okay, so these are two questions I want you to ask yourself. So the first question I want you to write down and think about is how. So how does facilitating active learning lead to better exam success? How does that happen for you? How does that happen for your students? What is it that you engage your students in order to help them achieve success on the exam? One example is going to be a learning guide. Another example could be study groups. Maybe we encourage students to develop study groups so that they can have better experiences collaborating with each other, answering each other's question, and then maybe we bring students into a study session with them and ask maybe their top 5 questions as an example. Okay, so again, how does facilitating active learning lead to better exam success for you as well as for your students? Then the second question I want you to reflect on is, what does your teaching plan look like? Some of the teaching techniques that we've already talked about that you'll further explore in Unit 3 and Chapter 14 is really around, how do I promote learning, right? How do I facilitate? How do I coach students through those 4 phases of Kolb's experiential learning theory and the cycles that are discussed in his work? What are those techniques that we're using? We've talked about role playing, simulations. Real-time feedback is also really important because that allows me to know what it is that I don't know. All right, so for the correct answer, if you chose B, provide a case scenario and ask students to create a care plan addressing the patient's immediate needs, you are correct. So give yourselves a round of applause if you chose B. And then I want you to think about, you don't have to put it in the comments. If you want to, that's great. But if you did get it correct, I want you to type in the comments application. Okay, I want you to type in the comments application if you did get it correct. This just kind of gauges us for how difficult this question was. We did try to create this one to be a little bit more difficult. So let's talk about the rationale, since it was a thought-provoking question. And we don't write questions for the CNE exams. Okay, so don't be too hard on yourself if you didn't choose B. A is more associated when you look at the statement of listing the steps. You might have thought, oh, lowest level. But actually, when you add the part about prioritizing care, it is more at the level of comprehension, okay? But maybe you knew it was an application. And then C, having students memorize, ding, ding, ding. Hopefully that was a key word that you automatically identified. And knowing that memorization, as I mentioned, is at that lowest level of the cognitive learning domain. And when you look at B, providing a case scenario, right, where students are going to be able to pull from their knowledge and apply it through developing that care plan. Okay, so hopefully the rationale makes sense for you all. And as you're thinking about the reflection of where you are as it relates to this content, I want you to write down your score. We like to do what we call a temperature check. So where are you on that scale of 1 to 5? 5, you're feeling like, you know what? I am really struggling with this content area. Okay, so we're going to flip it for this snapshot. So 5 is you're really struggling. 1 is you're right on track, right? So you answered the thought-provoking question correctly, or you understood the rationale, and you feel like you have a good grasp of around the concept of application and how it's going to help you achieve success. And 5 is you have no clue, and you definitely need to take a deeper dive, okay? And like I said, you can go to our website and see what resources we have available. If you don't see a resource that you think you really need, reach out to us, info@drssellarseducate.com. Billings and Halstead, Unit 3, Chapter 10 is where you want to start, but I mentioned Chapter 14 is really where you dig deep into those theoretical foundations and alignment with our why, okay? We want to understand the rationale. Even when we may understand and get the answer correct about the what are those teaching strategies, you also want to dig deeper into understanding the rationale. And then for Dr. Caputi's review book, it's going to be Chapter 1 and 2. And if you have our study workbook, it is Part 1 and Part 2, where you're going to find information that's going to help you clarify your muddy points. Until next time, we hope this snapshot has been helpful. We look forward to seeing you in our future programs. Reach out if you have questions. Have a great one, everybody. Take care.